Yes, this meeting will be recorded and placed onto our website. You've seen our agenda here. We're going to be talking, giving a neighborhood update. San Jose Police Department is here tonight. Thank you for coming, Lieutenant and Casey. District 10, Emma and George is here somewhere, maybe out in the parking lot. And then Barb St. Clair, National Alliance of Mental Illness, is going to give us a presentation. Thank you. Barbara?
Okay. So the neighborhood update is mostly about the park. One of the things we've been meaning to do for a long time is to put more information on our website about our activities in the park, and in particular about our native plant garden. And so I'm going to talk about the native plant garden briefly, and even more briefly about the trees that we planted in the park. We just put up a sign in the park. Do I need to be closer to it? Okay. We recently put up a sign in the park, and on the sign is a QR code which will take you to our website. This is the home page, and you see up on the I'll do it. Up on the top, there's a project menu item, and that leads you to two pages, one for the native plant garden and the other for the tree planting. The native plant garden has a lot of information in it. We planted it in 2021, and there's some pictures here showing the planting in 2021 and what it looked like immediately thereafter, and what it looks like now, at least in the spring when everything was flowering. And LPNA maintains, it was originally funded by a grant from the city and the park, but LPNA maintains the garden now. And we have a number of resources available related to the garden and related more generally to native plants. We have a detailed list of all the plants that we have in our garden, and listing when it flowers, how much sun it needs, how much water it needs, what kind of soil it likes, how big it's going to get. That's a big one, because people buy something in a little pot and they plant a whole bunch of them, and then they find out that they get 10 feet wide. So then below that are a number of different resources, websites. A particularly good one is CalScape, that you can look up individual plants, native plants, and much of the information, for instance, from that spreadsheet came from the CalScape website. Also, information on there's a presentation that was done to the California Native Plant Society that was specific to native plants that work well in our region. It's a nice slideshow, and there's a link to that. And it also has some planting tips. There's also another presentation that is specifically planting tips for native plants. And then the last piece of the resources is a senior moment, is the nurseries. So we are 3 nurseries that we've used, and those are listed there with links to their websites. And that's the native plant garden. Just go to that slide. Okay. The tree planting comes from the same menu that we got to the native plant garden on. We planted, I don't think I'm going to try to go to that website. It's too tedious. We planted 10 trees in December 2022, 2.5 years ago. We planted 2 oaks, 3 maples, and 5 elms. And what you see in that picture there are several of the elms that are around the the swing area in the playground. LPNA maintains those plants, those planted trees for 3 years at least. And if they're not fully established in 3 years, we have to continue until they are fully established. We water them initially on a weekly basis, and we also periodically have to prune and weed around the basins, et cetera. So there's a fair bit of labor that goes into maintaining those tree plantings. And so it's a significant commitment to volunteers. And because there's a lot of maintenance involved in these gardens in the park, we are very interested in getting more people who want to volunteer. And if anybody is interested in volunteering, there's an easy email address, and that is gardener@lospaseosneighbors.com. Another way which goes to my inbox. Another way to reach out is on the main page on the website. There's a contact us point in the menu, and you can just put your request or indicate your interest there, and that goes to Greg's mailbox. So there's 2 ways to get in touch if you're interested in volunteering. And now Greg's going to talk about National Night Out.
Every Tuesday, you all know this, first Tuesday in August, we have a big powwow meeting, didn't use that word, in the park. Los Paseos Park. Last year, about 650 people showed up, and we have a great band. We've got them all set up for this year. The band's coming again. The guy who blows bubbles as big as cars will show up. It's Brian, the bubble guy. And we're going to have some good times again on August 5th. So San Jose Fire Department going to be by. We're going to have free ice cream, free pizza. So spread the word in your neighborhood. You'll be soon seeing some information on that. These pictures show some of the people and events from the last years. That's all I have to say about that. So it's coming up in August, first Tuesday in August.
Greg, can you
Yes.
talk about the need for volunteers, please?
Karen brought up a good point. During this National Night Out, we serve pizza, and we need help at the pizza stand of people passing out pizzas to the line of people who come up. So we'll be looking for volunteers and asking for volunteers down the road. So if you would like to do it right now, you can volunteer and let me know.
Can I say a couple words?
Yes.
We
Speak more.
also hold a chalk art contest for the kids, and it's really nice to have a few people besides us as the judges. So if anybody is artistically inclined and likes that kind of stuff, but doesn't have a kid who's participating, we're always looking for people to help with judging. Thank you.
And cleanup at the end. We're usually done by 8:30 rolls around, it's dark enough, and then we're pretty much out of the park by 9 o'clock. Thank you all. I think that's it, right? Karen?
I think the next is the police, if they're there.
Yes.
They're going to give an update. So we probably want them on the camera.
Thank you.
And yeah.
Well, thank you for having me here today. Sure. Thank you. So thank you for having us here today. I'm a lieutenant with the San Jose Police Department. My name is Gary Thompson. Is that okay for the camera? Okay.
Yes.
just move the stand here. Okay, is it okay back if I stand back there? Or? Okay, all right, great. So, like I said, I want to thank you for having me here today. My name is Gary Thompson. I'm a lieutenant with the San Jose Police Department. I also have Casey Vess here from the department with crime prevention at the San Jose Police Department. Just a little bit about me. I just recently got promoted to lieutenant. I've been with the department for almost 24 years. I spent the last 4 years in internal affairs, so I'm trying to get acclimated to being back out in uniform and in a patrol car again. I guess some stats for you is over the time frame. What's the time frame?
The last 90 days since the last meeting that we had.
There's been 4 commercial burglaries, 4 vehicle burglaries, 0 residential burglaries, 0 aggravated assaults or robberies, and 0 homicides. And there have also been 0 injury vehicle accidents. Anything else to add to that?
That's the whole neighborhood association.
Yes.
Yeah.
Yeah, I believe some of yes, some of those do include like the commercial areas. Yeah.
So most of the time we just pull from the neighborhood association boundaries because we try not to pull from other areas to give you accurate data for your neighborhood association. So.
Yeah, that's my understanding. Is that
Can you
that's-
repeat the question, please?
They said that in the past, when they have had commercial burglaries, they're typically within the boundaries of the shopping center. We good?
So I know that there's been issues. We'll go from the stats there. I know there's been a lot of issues in the park. Just a little bit about the department recognizes that there are issues. We are addressing them. Some of the things that we have done is Captain Payne, who's the Southern Division captain, who is my supervisor, has sent patrol out for increased patrol, high visibility patrol during all shifts, days, swings, and mids. He's also sent out our special ops, our VSET unit. You may not see them because sometimes they are in undercover capacity, which does help them out. Sometimes they can catch people who are doing things in plain sight. So even though you may not see them, they are out there. They're in plainclothes. They're also in unmarked cars, but they have been doing enforcement. I believe we understand that some of these problems have been a result of maybe some people coming over from the schools. So Captain Payne has also recently been in contact with school liaison to see if we can get some help from them. Lieutenant Kilmer. So Lieutenant Kilmer is in Southern Division, and I'm in Southern Division on swings. He has one half of the week, and then I have the other. Right now, Lieutenant Kilmer is acting captain. Lieutenant Kilmer has also had, and myself have had increased patrol out here for high visibility patrol. I've been present in the park. Lieutenant Kilmer tries to make it out there every day. There's probably some people, I think he mentioned Greg and some other people that he's actually contacted in the park. Lieutenant Kilmer also contacted somebody with our gang intervention unit and is coordinating with them to go out to the park when we think there's some activity happening to see if they can make some contacts out there. But in general, like, you are our eyes and ears. So we want to hear from you when it comes to the park. We want the feedback. You have our contact information, our emails. Continue to email us. And if you see something, say something. You could always report it to the police department if you see something. On some, do you want to talk about the 311 app a little bit?
Yeah, so one of the things that stands out with the stats is that you have us coming out 164 times in the last 3 months, just proactively. But what I only see is 24 suspicious persons. So people said, hey, you know, I see something, it's kind of suspicious. We would like to see more reporting, because the more we're around, the more we can have a target to kind of come out and investigate. That might help suppress some of the activity at the park. Show of hands, how many people have the 311 app on their phone? 1, 2. Okay. So about 3/4 of the room, that's great. If you don't have the application for your phone, or you don't know how to do it, I would encourage you after to meet a neighbor who doesn't have it and show them how to use it. So what that does is, when you are out and about, and let's say you're at the park and there's some graffiti there, you can take a picture of it. It will geolocate where you are, therefore telling the city exactly the location of the graffiti or whatever you're reporting. And then you take a picture of it, it uploads there. If it is gang related, they try to get it down within 48 hours. And they're highly successful. A lot of times it'll be dealt with within 24 hours. It's a really good app. If you have potholes, lights out, lights for people who have tendencies to commit crime, they don't want to be lit up. New York Housing Authority and New York PD, they did a study. They replaced 1/2 of a city, of an area of a city, with lights. They just did all their lights, and then they left the other half of the city untouched. When they came back, they had a 39% decrease in crime. So report those lights that are out. That's about what I have to say for that. All right. 311. 311.
Can I ask a question? And this is actually more towards George Casey. So you just referenced the streetlight outages. I know there are tons of lights out, and particularly in our neighborhood and down on Bailey Ave, all those lights have been gutted for copper. And I know the city only has a limited resources of electricians to go and restore them, but I know those lights have been out literally since March.
Sure. So we'll have him speak to that. I don't know if you want to do it now or wait till you've got your. Yes.
So the city has come out with a relatively new ordinance. We're in the process of working on it now to allow the city to actually prosecute folks. There was some language that needed to be updated, and so that's in the works. But Casey, you were actually more in tune with what was going on in terms of we've tried a number of things to prevent this from happening, whether it was, you even mentioned concrete that we had put up, but folks are figuring out ways to get in there. We have folks that are coming out and doing additional patrols. I don't know that there's a silver bullet solution, but we're also figuring out ways to approach the folks that are buying the copper on a secondary market in order to prevent the market from even being there. But at the moment, along Coleman, this is a problem that's hitting the entire city. So District 8 here, and also the other part of District 10 along Coleman. So I wish I had a silver bullet answer. We're working towards it, but it's difficult to discourage folks. I mean, and as we were discussing in the case, they do a lot of damage when they go in there too. It's not just replacing the copper. They do damage to the entire system going in and coming out. So it takes a while. We're short-staffed. It takes a while to go back out, get the copper in there, fix all the damage that they've done. Wish I had a better answer for you, but yeah, it is a problem citywide.
I don't know, Lieutenant, you want to
Excuse me,
comment?
can you estimate a timing that you think it'll be fixed? Are we talking years or?
Well, I don't think years. I wish I could say when. But as I mentioned, just the scale of the problem, it's pretty big. We had Domingo Candelas mention a significant portion of his district, District 8, over in the Evergreen area, has been impacted as well. I can do some additional information, research, and find out time frame wise, but offhand, I can't tell you how long it'll take. I'm sorry.
Herb, go ahead. Unmute yourself.
I can talk. Thank you. Couple things. Was at the Basking Ridge meeting last night, and the lieutenant was there and mentioned some of these gang guys are carrying guns. And that's true. I'm going to ask everybody to be careful when they approach anybody in the park or anything like that. So, Lieutenant, can you discuss if arrests were made with guns, please?
You know,
I know a little bit about it because, unfortunately, I wasn't included in all the back and forth that was going between Lieutenant Kilmer. But I know that one of our crime prevention specialists went out and met with Mr. Peck, and they had a nice long discussion about activity in the area. That's one reason why I've had a lot of the patrols in the area, and they did catch people. So it's a ongoing issue, and we're aware of it. That's why they have undercover coming out. That's why they have the uniform coming out. And I got to tell you, people would kill to have 164 patrols. That's an enormous amount. So,
Well, as long as they don't get anybody of us, so that's why I'm bringing it up, so people beware of
Yeah.
how you observe and report when you get out there.
and that's the big
So-
thing, right? We want to do as a takeaway is to observe and then report. Report the suspicious activity. We don't want anybody coming in contact with these people because we just don't know what their intentions are. They may not even have weapons on them, but what if they do? And so people have been shot over more. So again, use your power observation, age, height, build. If they're getting into a car, if you just can get a partial plate number, the last 3 or 4, that would be great. Description of the car, description of the people. And maybe when you're walking away, you can use your Hey Siri and you take notes that way before you forget. So there's just a couple of tips there, but please just call if it's a non-emergent, if it's just a suspicious person, then you call the 408-277-8900. That's a non-emergency number. 311 is no longer non-emergency reportable.
and just a little more on your question there. I know of one instance where I think some of our officers went out. They contacted some juveniles in the park. They discovered that a juvenile was on probation, didn't have any weapons on him, but they ended up doing a probation search at that person's house where they did find the firearm. So even if they're not carrying them, sometimes people will have access to them. So that's why we just ask you, be careful. Don't confront people. Call the police and report it to us and let us do it.
Thank you. Thank you for that update and appreciate your work in our neighborhood and your patrols that you started keeping an eye on things around here. Appreciate it.
And just a couple other things I wanted to mention, other than the park, is that we recognize 4th of July is coming with the fireworks. We are going to have extra police out doing enforcement. In the past, we also have police officers riding with firefighters. And when the firefighters on view people shooting off fireworks, the officers are there to actually confiscate and cite people if necessary for the Muni Code. So we are planning on doing that. Sideshows, I know everybody's interested in sideshows. The new ordinance that they created is working. It's taken some time, but it is working. I have seen, I was on midnights, and then now I've come to swing shift, so I'm working at night. My perspective is we have seen a little decrease in sideshows. I don't know if that's what you're seeing, but part of that is the district attorney is actually charging people now. We have a Muni Code that's pretty new in San Jose. Not only going after the people that are at the show, but they're doing long-term investigations, and we are actually charging the people who are promoting these shows, people that are going on social media and advertising to everybody, hey, come to this location. We actually are charging those people now as well. But we're going to continue our enforcement. And if you ever see a sideshow or anything like that, feel free to call it. We want you to call us so that we can go address it before it gets out of control.
Thank you. By calling you, how do you call again? Through?
The 311 is changed.
Yeah, that 311 is no longer reportable. It's a 10-digit number. It's 408-277-8900. 408-277-8900. That's the
Okay.
non-emergency number.
Okay,
And
that's the one
those
we
same
call.
the same dispatchers that answer 911 also answer those calls. So it might ring for a while
Okay,
because they're prioritizing.
Yeah,
Okay.
that goes straight to our dispatch.
okay,
If I need dispatch, that's the same number I call.
okay,
So they can be busy,
okay, thank you.
but they're pretty good about answering right away. Do you have anything you want to add?
Just an update on the motorhomes. Those are slated off of Rio de Oro. They are now slated for being removed, and we don't have a date on that yet, but they are in process of getting a date and doing that. But it's on. You can actually go to the website, the Olive website, and that will pull up a map, and you can see that it's orange, which means that they're going to be in process soon.
What website is that?
I'll leave. I printed the whole copy
Okay.
here, and whoever wants to look at it can.
Okay, great, thank you.
I think that's it. Are there any questions?
I think you answered a lot of them that we had in our minds already, so thank you.
They're
All right.
letting you off easy.
Yeah.
Well, thank you very much.
Thank you.
Good to see you. Thanks a lot. Thanks. Right,
So Greg, next is District 10.
yes. He's coming.
Okay.
You look picture better. You're just a good looking person. You probably heard me. Everybody heard me.
Thank you.
Take care, you guys.
This thing on? Feel like James Brown. I'll do a little dance. So briefly, I was told that I should touch on the budget that was just passed, the mayor's June budget message. Sorry, it's been a long few days. So those of you that didn't know, Monday, from 6 o'clock until about 11 o'clock, we had roughly 400 people show up and comment on the budget and a number of other items. And then Tuesday from 11 a.m. essentially all the way till about 9:30, 10 o'clock, we worked on the budget and other items. So it's been a slog here these last few days. So apologize if I'm a little sluggish. So there were two, I guess, controversial issues in the mayor's budget. One was the pay for performance, and that was tying 5% of the council, the mayors, and the senior executives' salaries to performance measures that we would decide ahead of time, whether it was create X amount of houses or whatnot. That was voted down. The mayor, it was his plan, obviously. I voted for it. Mulcahy voted for it. And Pam Foley voted for it. It was just the four of us. The rest of the council members voted against it. And so we're still working on implementing that in other ways, potentially making it a ballot measure. The second controversial piece that did pass was the responsibility to shelter. This was the item where within 18 months, if an individual had been approached and offered shelter and they denied it, that we could cite them or arrest them for trespassing. The goal being oftentimes these individuals are suffering from some sort of mental health crisis or they have a drug issue and they're not making rational decisions. And so this is an opportunity, essentially a tool for us to get them in front of a judge potentially and get them the help that they need. It's controversial. Some folks don't believe that that's the case. The county has mentioned that they wouldn't work with us anyway, but the goal was, the understanding is we have a deal with a lot of folks, particularly here, if we put an EIH in your neighborhood in order to deal with some sort of encampment, well, the goal is everyone in that encampment would go inside. And then if we drive around, there's still folks in the encampment, you sort of feel like you got gypped on the deal. And so this is what's happening. A number of folks are not going inside for a variety of reasons. But it's my understanding the intent behind this was not to criminalize the unhoused, but to have another tool, another opportunity to get folks the help they potentially need. I was told I should, if there's any questions on the budget first. Second controversial thing is I canceled the 4th of July at the Almaden Lake. And the reason being, what's that? Oh, right on. I didn't expect. I think a lot of folks are going to be more upset than appreciative, but frankly, the event had outgrown the venue. We had over 30,000 people show up last year, and it was extremely hot last year, and still we had that many people come through. And the reality is, when the fireworks are going off, we actually have folks that stop in the major arteries along Almond Expressway, Coleman, Winfield, and Santa Teresa. Now, God forbid, if there were some medical emergency, a fire, we couldn't get public safety officials in to render services. We actually had 2 fires. It wasn't the actual event that started the fires, but folks that park all around in the neighborhoods, they illegally park. Firefighters had a difficult time accessing and getting to the fire. We were fortunate that it wasn't as bad as it ended up being. And there was a second fire that actually impacted someone's backyard to the tune of $200,000 in damage. Then you have obviously all of the parking that goes on immediately around there. And so again, I talked to the fire chief and the police chief, and I asked them, if this were just a regular event, would you sign off on this? It's a city sponsored event, so we don't have to go through the normal protocol. But I'm asking you as a council member in charge here, I want you to evaluate this event. Would you sign it off on it for me? And they said, no, we couldn't. So out of an abundance of caution, I decided to cancel the event. The goal was to move it to the county fairgrounds because they have the space to accommodate that many people. They have parking. The goal was for it to be a free event, but charge $10 for parking, an opportunity to recoup a lot of the costs. My goal was to make it a net neutral cost so that we wouldn't actually have to fund it through the city anymore, and we could have more folks come out. The problem is I came into office in December. We just started this discussion in January. It was, again, difficult to have public safety come together with a plan for 30,000 people in such short notice. So the goal is to have it at the fairgrounds next July 4th. So any questions on the 4th of July?
Karen, your hand was raised. It's down now. Did you have a question? She left. Karen, did you have a question or did you lower your hand?
Sorry. Well, I was confused because I got an email saying that the fireworks had been canceled at the fairgrounds, and I was like, I didn't know it was at the fairgrounds. So as soon as he started talking, I realized, oh, okay, that's what happened.
Yeah. So the goal is to have it someplace where we can do it safely, and there was no way in my mind that I feel comfortable doing it at Almaden Lake anymore. It was actually irresponsible for us to have it the last 2 years that we had it there based on the numbers that showed up.
George, it used to be at downtown San Jose in Discovery Park. Is that one still happening or no?
No, they do one now at the Giants, San Jose Giants Stadium. And there's another one now that last year was the first year at Lake Cunningham for District 8. Ours would have been another one roughly in the same area as the San Jose Giants, but we would have done it at a different time, sort of staggered it. But yeah, it's no longer at the Discovery Park.
Thank you very much for that update.
No problem. That was painless.
Yes. You know what I'd like to do sometime? This is fairly new to the people in District 10, our area. When it was redistricted.
Yeah.
And I don't know how much time you spend along Santa Teresa in the 2 neighborhoods on both sides, but maybe someday that we could take a ride together.
Absolutely.
With a couple of us and show you around. We could show you around.
Oh, I'm here all the time. So I live
you do?
off Santa Teresa.
Okay.
So I grew up here, Santa Teresa and Cottle.
Okay.
In Rancho Santa Teresa neighborhood, and I live at Santa Teresa and Cahalan.
Okay.
And I come here to go to Lowe's or get round table here or anyway.
Perfect.
So I'm
Okay.
always in this area.
Moonbeams.
Yeah, the coffee, absolutely. Yeah.
Alrighty. All right.
I have a
Let's play.
question.
Uh-oh.
Sorry, Councilman.
No problem.
So could we talk to our DOT director, John, about maybe doing some solar lighting? I almost hit a couple people off of Burnell there because of this has been out, and maybe make some change instead of using all this copper that's getting ripped off and causing problems. We have solar lighting in our park, which has worked pretty well, and maybe some key intersections we put solar in them so we have some lighting. So if we could maybe talk to John and see if we could get something going there, at least a pilot program in certain areas, because we have a lot of the unsheltered people on bikes at night, and I've almost killed two of them the
Oh,
past
wow.
year because they're jumping across and you can't see them because the lights have been out. So
So,
maybe something we could work on with him.
so if I understand it correctly, you're saying solar doesn't utilize the same, obviously not electricity, so it wouldn't require copper, and so it'd
Nope.
just be another source. Okay, yeah, happy to talk to
So,
John about
so,
it.
so yeah, I mean, other John, the head electrician, put the solar lights in our park, a few years ago, and they're satellite managed and the whole bit. Great. I don't know if we can afford those, but maybe a conversation that we could have and see if we can come up with some certain intersections and areas where we're not even using the copper anymore.
Well, definitely makes sense to consider it. So we'll definitely touch base with John and circle back.
That'd be great. Thank you.
Thank you, Herb.
Thank you, George. Appreciate. And Hema, thank you very much for your support. All right. Karen.
Yeah, so is Barb St. Clair there?
See ya. Love to see you guys.
Oh, there she is. Okay, let's
There
get
we
her
go.
situated. And I'll go ahead and introduce Barb. So Barb is with NAMI for over 15 years. She's worn many hats at NAMI. She's facilitated education classes, coordinated multiple programs, and worked on the NAMI helpline. She retired in 2022 after 45 years in technical sales, and she's excited to be working on an outreach role, expanding the NAMI programs within Santa Clara County. Barb is a family member of NAMI whose son, John, lived with schizophrenia for 25 years. So she has quite a bit of experience with it. And she's going to give us an overview on NAMI and what they do, as well as a presentation on what they call parity, which she'll have to explain a little bit more about what that means. It's okay. Thank you, Barb.
Oh, you're very welcome. I'm very glad to be here. And let me just wait for the present. There we go. Okay, you can go to the next slide. There we go. The next slide, please. Okay, so who's NAMI? NAMI is the National Alliance on Mental Illness. And so we're the largest grassroots mental health organization in the country. We're in every state, we're also in Canada. And we have 56 affiliates in California. We just celebrated this year 50 years within Santa Clara County. So it was a big celebration this year. So you can go to the next. Okay, we provide support, education, and advocacy for individuals as well as their families who live with mental health conditions. Okay? We worked very hard to reduce stigma, promote research, and also improve services for individuals and their families who live with mental health conditions. Continue. Okay, so what we're going to talk about today, we're going to talk a little bit about mental health statistics within Santa Clara County, talk about the NAMI programs, and then just touch upon, Karen and Greg asked me to kind of touch upon housing for the unhoused and kind of NAMI's role in that. And then we're going to talk a little bit about know your rights. Because Santa Clara County declared a mental health crisis, they put together a short presentation to tell you what signs to look for, how to access care, and what are your rights as far as access. And we'll go through that when we do that presentation. You can go next. So today, 1 in 5 adults live with mental health conditions. That's a staggering number. Locally, that means 340,000 adults, and locally, that means 68,000 youths. That's in Santa Clara County. You can go next. 50% of all serious mental health conditions begin by age 14. 75% by age 24. So there's this window of when this all tends to occur. Next. These are some common mental health conditions: anxiety, depression, eating disorders, post-traumatic stress syndrome, bipolar disorder. Some of you are probably familiar with these. Next. So NAMI programs. What's important to know is that all NAMI programs are free, and they're all peer-led. And what that means is that if you decided to join an education class because you had a loved one that was ill and you were a family member, then the class instructors would all be family members who have a loved one that is ill with a mental health condition. If you joined a support group for folks that have a mental health condition, the group would be facilitated by people who live with a mental health condition. That's very, very powerful. Next. So we provide education class for individuals as well as families. They're both 9-week classes, and there's a lot of shame and blame associated with mental health conditions. Many people, even today, still believe that it's lack of character or bad parenting, something you can shake off. It's not. So we spend the first couple of weeks really addressing that and talking about the brain, what's going on with the brain, how medication impacts the brain. With this particular class, we talk about how to prevent a relapse, how to stay well, how to advocate for yourself. Education is key, and these classes are a game changer, and they're free. Next would be the family class. Same 9 weeks. We spend the beginning to really hit home that no one's to blame. And then we talk about communications, how to talk respectfully, how to really improve communications so you get a dialogue going with your loved one. We talk about how to manage a crisis, how to problem solve. You walk out of this class with a lot of tools, and connection with family members and friends is key. You know, we were just talking about the unhoused community, and a lot of those folks have lost all their friends and families, and that's how they happen to be in the situation that they're in. Next. Education for providers. We train, it used to be just healthcare providers. Today we train case managers, we train front desk receptionists, we train maintenance people. A lot of these housing complexes, we go in and anyone who works with the residents, we train them. It's a 5-week class, and it really just handles misconceptions about mental health conditions and really strengthens them so that they effectively can communicate and problem solve with folks that are living with a mental health condition. Next. Support groups. We have support groups for individuals, families. We have support groups for families who might have a loved one that's in the court system or is currently incarcerated. We have family support groups for transitional parents of transitional age youths, meaning the 14 to 22 years old, and we have family support groups for adults. Next. We have a helpline that is and I've left helpline cards on the table. It's a resource I hope you'll all use. It's available 10 to 6 daily. There is an after-hour call that we'll take and we'll return the next day. You can walk into our office from 10 to 6 daily. This is a resource line. Any resources in Santa Clara County, we have a very robust database. You can call about housing. You can call about legal. You can call looking for therapy, whatever you need. And this team will brainstorm with you to find resources that will help you with whatever's going on. Next. This is an online class for children, parents who have children under 22. The focus is really how to advocate for your child with the education system, which that can be real challenging. Next. Okay. We do presentations out in the community. The Ending the Silence, if you'd go back one. Next. Nope. Back to, and there we go, right here. Ending the Silence, we go into schools. This is middle school and high school. We have 3 presentations, one for the students, one for the faculty, and one for the parents. And this is to increase awareness, start the dialogue, how to talk to a friend if you feel that they're starting to have some difficulty, what to do if you are starting to feel that that you need some assistance. It's talks about how to be a good friend and what resources are available. We also do In Our Own Voice, and that's a presentation for folks that are over 18, and it's 2 presenters, and they come and tell their story of recovery. We do this in a lot of the housing complexes. We do this in clinics, any place where people can gather. It's very impactful. They tell their story, the dark days. They talk about what helped them and then what keeps them well. Okay, next. Okay, right there. We go into the workplace. Mental illness is pretty widespread in the workplace. So we go in and same type of thing. We increase awareness. You know, what do you do if a colleague seems to be having difficulty? What do you do if you're having difficulty? What is the signs and what resources are available? We work very closely with human resources. Know Your Rights. It's a 60-minute presentation that I'm going to do in 5 minutes, but I'm going to point you to a website that you can listen to the presentation again, and all the resources are here. California's a really special place to live in that we have laws about your rights to access care, what to do if you face challenges, and parity laws that indicates that your mental health and substance use should be treated exactly like medical and surgical benefits. And there are laws to support that. Next. Let's just talk about the housing. Karen and Greg had mentioned that there were a number of houses coming up in the area. Well, that's happening all over San Jose. And I just wanted to make a couple of points. I'm not a housing expert. I'm not a clinician. I'm a family member who looked for 10 years for housing for my son. And so I've done a lot of trial and error. And I do know that with serious mental illness, many people lose their family and friends. And it's not because their family and friends are bad people, it's that they haven't been educated, they don't have the tools, they don't have the support, they become overwhelmed, so they just disappear. You know, with that serious mental illness, you can easily lose your job, your income, and then as a result, lose your housing. So this new housing that we're seeing all over Santa Clara County, I'll tell you, it's amazing. I spend 30% of my time working with agencies that support these folks that have been moved into these homes. They're safe, they're affordable, they're durable, and there's staff on site to help them. So really, what else is needed? Next. Okay, so what we do is we go in and we train the on-site staff, make certain that they are knowledgeable, comfortable, and have the correct tools to work with folks that have mental health conditions. We do site presentations. We go in and do a general presentation on the NAMI programs, and we do stories of recovery. So both of those presentations we do on site. And we also have a program, it's called the Community Support Program. It's a mentoring program. And you can actually go, there we go. And this is a program where, and again, NAMI programs are all free. We will assign someone a mentor that will help them re-enter into the community. Very often, people who have been homeless or people who are just recovering from mental health conditions, they're doing pretty well, but they're isolated and they've lost their family and friends, so they don't know how to get back into the community. This is a 4-month program where a trained mentor will meet with them in person, 1 to 3 hours a week, and do 2 check-in calls. This is a game changer. It gets people back into the community and potentially back into the workforce. And again, this is all free. Okay, this is our walk. I hope you'll come and join us. It's our biggest fundraiser, but it's a fun time as well. Music, food, and we all walk to increase awareness about mental health. It's in History Park, and it's October 4th. And this flyer is right up on the table. Next. Okay, and again, that was quick. If anything resonates with you, we would love to help, whether it be you or a loved one, or if you know of an organization that could benefit from our programs. Helpline card is on the desk as well as my card, and my card has my cell phone, so don't hesitate to call.
Thank you, Barb.
You're welcome.
That was very informative, and I didn't know all this existed. I have a question. Karen and I are on an advisory group for the Rue Ferrari site in the Bernal Road, emergency or normal housing. And I've never heard them talk about this. Have you, Karen? The help that you give, you say you give like Home First and Life Moves.
Yeah,
Is that you work with them?
Life Moves.
Yeah.
Yeah, they may do
Sorry,
it, but
about
Okay. About
Catholic Charity.
okay.
do you work with Home First?
You work with Home First?
Home First we refer people to, but no, we're
Oh,
not.
okay.
Yeah, so the two interim housing places around us, 2 of them are run by Home First, so they would be a good organization to reach
Okay.
out to. Life Moves is running the Via del Oro, and are they running the safe parking, Greg?
Yes.
Yeah, Life Moves. So the 2 that are most prevalent in our area as far as providers are Life Moves and Home First.
I'll reach out to Home First.
Yeah.
You know, I'm working my way through the valley.
If you need a
Mhm.
contact, we can get you a contact.
Yeah.
Yeah. All right. Cool.
They're all free and they're very impactful. Very impactful.
I don't understand how you could be free. These, when you say pair, are these people with kind of education to take care of this, or they're just from experience?
We send them education.
Okay.
They all have lived experience. Once they've successfully gone through the education program, then we take them, we mentor them, we train them further, and they're monitored very closely.
I see.
So it's someone who has gone through the path of recovery
Yeah.
and knows all the tools, knows the work that you have to do to stay well.
Yeah.
And so it's a fabulous program.
I have a question for the audience. Is there any comment for the audience? Have you ever heard of this program that you both, yeah. Oh, sorry. Hold on a second.
So I have heard about NAMI, and I've actually met Barb. Yeah, I work at Crestwood, and I'd like to introduce you to Susan afterwards. She's with the YMCA. So I have heard about this
Okay.
program, and we have plenty of brochures at our facility. I think it's an amazing program. We have clients at our facility who they graduate. We are a fully locked psychiatric facility, and we do have clients that graduate, and we do have peer support specialists actually who work at our facility who have had mental health issues. They've been in locked facilities.
Okay.
They've done all the work. They've taken the medicines and therapies, and now they work peer to peer. So
Okay.
it's I think a very valuable.
Yeah, let me ask you a question.
Mhm.
In the neighborhood of where we live, you live and we live down there by Bernal, there's like 1,500 houses. What percentage of the people do you think out there know what good work is being done with this? How do you think we spread the word about this great service?
I'm not sure how we spread the word, but I don't think that the word is spread well enough.
Yeah.
It used to be all our came medical. And the past year and a half, we're going to switch that up, where we're going out to the housing agency and aggressively going to where the people are. And so, yeah, it's a work.
That's what I'd like to work with you on that. We want to spread the word about the goodness and the help that you're giving people, because it's not all bad out there. There's a lot of people that have recovered, right?
I think that there's so many more people who need these services than
Mhm.
Educate, support, and volunteer groups,
Yeah.
training, professional skills. And we have 2 people just this month have been accepted in master programs in social work.
Wow.
And these folks, one of them I've known for 10 years, and I've seen the journey.
Yeah.
Yeah, I think the support that this organization offers, peer to peer is invaluable.
Great. Can you pass the mic back to David? Thank you
Hi.
for that comment, by the way. Appreciate it.
I'm a visitor from another planet. Greg knows me well. The county has a group called Trust. Are you familiar with that group? How do you work with them?
In fact, they're included in the next presentation. And
Not the one you did, but the upcoming one?
the upcoming one. It's only.
Oh, there's another
Minutes.
presentation coming?
Mhm.
Oh, I jumped the gun.
No, that's okay.
Okay.
But Trust is, I was thinking about them as the police officers are here. Trust and 988 is an organization that can really support the police by moving non-criminal responses off their plate. And so 988 is the best number to call if you have a mental health emergency. And you'll talk to the person, they'll assess. If it's non-emergency, then they might deploy, and if it's non-emergency and you need mobile support, then they will deploy deployed the trust team to come out. And this trust team includes a social worker, an EMT, and a peer specialist. And they'll come out, assess the situation, and make recommendations. And if it looks as though someone does need to be involuntarily hospitalized, then they'll facilitate that. But it's all about de-escalation and coming out to people and encouraging the community. Don't wait until it's an emergency. As soon as you see things start going south and you need some support, call 988. Where people in the past, when they had to call 911, it's like that's a hard thing to do, you know, particularly when you know that, you know, it's not intentional. This is a loved one that is just having a mental health crisis. So people waited until it had completely gone south. With 988, call. Don't wait. If you need some help really assessing the situation, call 988. And if it's non-emergency, then ask for the trust team.
It was my understanding that a lot of homeless people, they are homeless because of some mental problems. How do you approach them? Do you approach them or?
I can only offer my opinion. I think some people are not well enough to be housed. They need to be hospitalized. People who are well enough to be housed, they have to be housed before you can even begin the process.
Okay.
Okay,
Thank you.
so I mean, it's just I went into one of the housing apartments that all of the residents were unhoused, and this is when I first started, and I asked the site manager, I said, what percentage of the residents are mentally ill? And she said, they all are. They've been unhoused, they've been homeless. You know, they've experienced the trauma of being homeless, which translates into PTSD, post-traumatic stress disorder. So yeah, she said 100%, every single person in this residence. So.
Okay, but the people living on the street in the tents, they don't have the contact with NAMI.
Sometimes. Yeah, we have a volunteer group that is very low pressure. It's 3 hours a day, twice a week. People can come and help fold brochures, eat snacks, do puzzles. And we see a lot of folks that are just at the beginning of their recovery journey that come, you know, and we constantly watch and make recommendations. Perhaps you'd like to do a class, support group.
San Jose Housing Department?
No.
At all? They have a plan of going out to the encampments and asking them how, and they get quite a good percentage to say, no, I don't want to go there. Yeah. So those people, maybe they need your help. The ones that they're asking that are not accepting the housing. There's a link there that could get more contact with people. People that need help.
Absolutely. I mean, I would always give it a go. Always.
I'd like to ask a question. And it does, it indirectly relates to the homelessness. I have a concern about the availability of inpatient beds for referrals. I know that Good Sam closed their facility, and so that was a net loss of beds in the county. What is the situation? I mean, how long are the waits, and what percentage of the people who need an inpatient bed because they're in a serious crisis are not able to get it?
I can't speak to that. Obviously, it is an issue and it's an ongoing battle, but I don't have the statistics, and so I can't speak.
But it is you're aware of it as a concern.
ongoing problem. I work in a It is an ongoing problem in the county. I do work in a locked psychiatric facility, and we have an acute unit that has 16 beds, which are always full. And we have a unit that has 100 beds, and it is always full. And there are waiting lists for both of them. So I can't tell you how long the list is, but there are always waiting lists. So.
This presentation is so quick, but I think it's important. And oh, do you all have this?
I made some copies.
So as you guys are getting ready to queue up the second presentation, oh, Greg, I put these in the slideshow.
Okay.
So for the parity presentation, if you can just pull up the parity presentation, and also make sure Barb is closer to the mic.
Oh, okay. I'm sorry.
Right. Yeah, just right now, while you were walking around, we couldn't hear you. So when you start the presentation,
okay.
now you're perfect. That's perfect.
Okay. Let me see. So, Santa Clara County, they declared a mental health crisis, and because of that, they put together this presentation to get out into the community. They did it in partnership with Bay Area Legal and NAMI Santa Clara County, and they realized that people needed to understand what are the symptoms, what to look for. They needed to know how to access mental health care, and they also needed to know what their rights were, and what to do if the care wasn't forthcoming. Okay, so that's what this is all about. And yeah, they wanted to keep track of how impactful this presentation is. So if you could just kind of where you're at before the presentation, and then there's another link for after the presentation. It goes directly into Santa Clara County, but if you could do that, that would be great. Okay, so signs to recognize. Okay, so the main ones are the drastic change in mood or behavior, possibly feeling sad or empty, thoughts of death or suicide, and just generally feelings of hopelessness. And the rule of thumb is if this is the case for more than 2 weeks, then you probably should seek some help. Okay. Okay, accessing care. We had talked about 988. And so 988 will get you into it'll be a mental health counselor. They'll assess. And if you need emergency assistance, they'll dispatch it. If you need the person hospitalized immediately, they'll handle it. And they also will do mobile support. And the mobile support is either CIT emergency, which would include a police officer, or the trust team, which does not include a police officer. And that is for adults and youths as well. So children as well as adults can be supported through 988. If you are calling outside of, if you're calling outside of the 408, 669 or 650 area code, you'll want to call the 800 number. Okay. So these are the federal, back one. These are the federal laws. There we go. Back one. These are the federal laws that that provide the regulations that support parity within your commercial insurance providers, okay? This is not Medicare or Medicaid, it's commercial insurance that is regulated. And these are the laws that do regulate that. Access to timely care and parity within. So some of the things that you should know, mental health and substance use disorders are required benefits. For a plan to cover any treatment or procedure, something must be needed to diagnose. So for example, if you have diabetes, you need to have a test taken before treatment is offered. The law defines medical necessity, and that includes mental health conditions as well as substance use services. So the law requires for mental health and substance use disorder to be the same. So, for example, if you have 10 visits for an orthopedic care for from an orthopedic doctor within your plan, you should have 10 visits allowed for mental health or substance use care. Okay, now that doesn't mean that every plan is going to be the same. Whatever plan you sign up for, that's the plan, but it has to be equal among all services. They can't pick and choose. They can't restrict the care that you would receive for mental health conditions. And that's called parity. Okay. What also has to be at parity is financial, your deductibles, your co-payments, co-insurance, out of pocket, number of days, visits, frequency of treatment, it all has to be the same. And if you don't feel that that's happening, we're going to go into what you should do. Okay, so these are all that need to be at parity. And if we go back one, no, forward, there we go, one again. Okay, this is a snapshot, and you'll see that in California, you're allotted 10 visits and 10 follow-up visits. And your provider needs to respond to you within 10 days, and they need to follow up with you within 10 days. Your provider needs to provide a network within 15 minutes from your home or 30 minutes. So if you're hearing, no, we don't have anyone to see you for a month, don't let it go. So that's what this is all about. This is all on the county website. And so if you're running into any trouble, the first thing you need to know is know what your rights are, and then how to work through the process to make sure you get the appropriate care. Okay. So covered conditions include, but are not limited, all of the mental health as well as substance use conditions, inpatient and outpatient, and you have financial protections. So for example, if, boy, oh boy, I think glasses. Okay, if I can't find a provider in my health plan's network that is accepting patients and nobody can see me for a month, do I accept that? No, no. Must be within 10 business days. My health plan limits the number of visits with my psychologist, but I don't have the same limits as my doctor. Do I need to accept that? No, they have to be the same. My health plan did not pay for my behavioral health service. You don't accept that either. Okay. So what you do is you follow up with your health plan. Next. So the first thing, you need to understand your rights. And if you're concerned, you need to first contact your health plan. And we suggest you do everything in writing. And then you need to look at your health plan and understand the process to submit a complaint or appeal. You go ahead and do that. Next. So you submit it within, you submit it verbally or in writing, preferred in writing, and then the law requires that the health plan needs to respond back to you within 30 days. If you disagree with the decision or you didn't receive a decision within 30 days, then you call the California Department of Managed Healthcare, and they will help you out. Next. So you submit your complaint online by mail or by fax, and you have to submit your complaint within 180 days from when you got the denial. Okay, so there's some timelines that you need to be aware of. So they'll review the complaint and they'll come back to you acknowledging that they have received the complaint within 7 days. If they disagree with your health plan, they'll go ahead and instruct them to pay for it or extend you the visits, whatever, issue you have complained about. Next. Okay, here are some other resources. Yeah, and so you can call NAMI. The helpline is trained on parity and access to care. Or you can call the Department of Managed Healthcare. Those are great places to start. And there's also the Department of Insurance. So just be aware that California has parity laws. And if you're not getting the treatment that you should, then don't allow it. Go ahead. Oh, okay.
Karen.
Karen?
Yeah.
Oh, did you have a question?
Well, I was gonna just prepare for the end. You're close to the end, and then I'll
Yep,
ask
we're just about here. Yep. Okay, and there's the website, Santa Clara County website. An entire presentation, much better than the one I've done. It will be on there, so you can listen to it. And all of the resources, fact sheets, answers to questions are there too. Okay, I think we're good. And I appreciate everyone listening to me. I hope we see you at NAMI. And I hope this has been helpful as far as, mental health care and substance use condition care. And that's it.
Yeah. So the QR code for the post presentation was in the presentation on the last slide. Could you put it back up there, please?
Okay. Thank you, Karen.
Yeah. So my question is, we kind of all are aware that there is an enormous shortage of not only beds, but workers, people that are dealing with this stuff. So it's almost like, it sounds like they're putting these unrealistic laws. It's kind of like the whole electric vehicle. Well, we have to go electric vehicle, but we're not going to have enough electricity to run the electric, it's kind of, I think it's positive that we have these laws, but it's also kind of a false sense of hope because I don't see them having the care workers. So what it sounds like to me is the squeaky wheel gets the grease. And if you are very squeaky, you're going to get the services you need. But if you are not, you're just going to get by the wayside.
Well, exactly. You need to file complaints and you need to hold their feet to the fire. If they need to hire more psychiatrists or, this will all, again, we had talked about closing of facilities. So you've got to complain and by law, they need to be able to respond to you, whether or not they go to another provider. And we see this all the time where a hospital doesn't have any beds, so they have to send a person to another provider to get the care. So it's not perfect, Karen, by any stretch of the imagination, but if we do nothing and if we don't fight for the care that we deserve, then things are not going to move forward.
Right.
Okay, wonderful. Oh. Now, this will go straight into Santa Clara County, and I appreciate everybody doing this. Go ahead.
If I recall, President Reagan closed all the mental facilities.
Right.
Does government has any plans to reopen or some or?
I don't know. I don't know. I mean, it's, I think it's probably going to be a combination of the housing that you're seeing for people who are well enough to live independently. And that's another reason why we need to insist upon the care that is needed, you know, and that'll start making some progress.
Thank you.
You're welcome. Okay. Thank you, everybody.
I had a question.
Thank you, Barb. Learned a lot.
Go ahead, Herb.
So from your perspective, you've been there a long time. In our neighborhood, we deal with a lot of different situations. One winter I had a couple with no shoes on. It's raining and they're sleeping in the Taco Bell parking lot. And I'm trying to get resources from them. The city's closed their 9 to 5 line. Police department doesn't want anything to do with it. Where can we find resources for these people that need it right away? And I know it's kind of off your presentation, but it's kind of needed. And I felt real bad for the people. And we have a lot of people in our neighborhood, no shoes on and things. And I try to help as much as I can. But where's the resource? I know county and city are separated. Who can we ask for help when it's like 9 o'clock at night?
Well, there's a couple of things you can do. You can call 988 and request a wellness check. That you've got some people that are cold, they don't look like they're doing well, and could they send someone out to talk with them and
Is that county or
assess?
city? Is that county or city that comes out?
That's
if I call
county.
988?
County.
Okay, so they're supposed to have somebody
Yeah,
24 hours.
so 988, yeah, you can
Okay.
call them and they'll come out. Now, if the situation is not dire, then you can have them call NAMI helpline.
Okay.
And we can coach them on, these are the agencies that can get you temporary housing, can get you off the street. These are the agencies that provide food. These are the agencies. So the helpline will provide resources.
Okay. Well, I mean, 988,
They
that's a
can
start.
call 24 hours, but we're only there from 10 to 6. But we
Okay.
will call them back immediately, upon getting into.
Yeah.
So if it's an emergency and you're really concerned, I would call 988.
Okay.
And
Well,
ask
that's what
for
I'm going to try
wellness.
next time because the city line's 9 to 5. The police have too much to go on, but there's a lot of the individuals in our neighborhood
Yeah.
that come up like that. And I mean, these guys are freezing. It's wet. And, Taco Bell manager's trying to help them, but she can't do, she's
Yeah.
locked up. So, all right, good.
Yeah, I
988.
mean, when you call, don't sugarcoat it. Make sure that you tell them that these people really need a wellness check. They're in a bad way.
So who comes out? Is it a county social worker?
Well,
or?
if it's the trust team, then it's a social worker, an EMT, as well as a
Okay.
peer specialist. And that's someone with lived experience
Okay.
with mental health conditions. And usually, they've experienced homelessness.
Okay. Very good. I appreciate
Okay.
your answer
Oh,
and
you're
information.
welcome. You're welcome.
Thank you, Barb.
Thank you very much, Barb.
Thank you very
Great,
much.
great presentation, great information.
Yes.
Are there any more
I'm sorry.
questions?
We missed one thing in this meeting. Approval of the minutes that we put on the website. Do we have anyone who would like to make an amendment? I hear nothing. I see no raised hands. Oh, I motion that the minutes be approved. The
Second the motion.
second motion, vote. Removal. The minutes are approved. Thank you. Thank you, Lynn. All right. I think, Barbara, do you have anything else you'd like to add, or Karen?
Nope.
I have one thing.
Oh,
Okay,
yeah.
Herb
Herb
wants
wanted
2
his 2
minutes.
minutes.
I got my 2 minutes. The Sales and Neighborhood CERT group is putting on personal emergency preparedness classes for an hour and a half to get families and people ready to go in case there's an emergency or just general things that happen. If you're interested, get a hold of me at my email is kd6irg@yahoo.com. We'll probably do one. I'm asking Greg to do one at the HOA, maybe at the end of the month here. So if you're interested, send me an email or talk to Greg, and we'll try to get it set up for the neighborhood. We're trying to get us all prepared for anything that happens or could happen for your families and the community. So let me know if you're interested, and we'll schedule a class up, and we'll do it probably with Basking Ridge. So thank you.
Sounds great, Herb. We'll be prepared in all areas of life pretty soon. Thank you. The meeting is adjourned.
Thank you.
Thank you.
Thanks, everybody, for coming.
Thanks.
Thank you.
Your patience with our technical difficulties.